Hi, this is Dr. Goutham, Consultant Pediatrician, Motherhood Hospital, Banshankari, Bangalore. Influenza is a viral infection that attacks your respiratory system. For most people, flu resolves on its own, but sometimes influenza's complications can be deadly. Everyone is susceptible for flu. People at high risk of developing flu complications include children younger than 5 years of age, especially those under 2 years, adults older than 65 years, and children with asthma and immunity problems. Flu-related complications include pneumonia, dehydration, worsening of asthma, brain dysfunction such as encephalopathy, sinus and ear infections, and rarely death. Among reported pediatric deaths, 80% of the children were not fully vaccinated. There are many reasons to get influenza vaccine each year. Because of the ongoing COVID-19 pandemic and flu season approaching near us, experts are warning of twindemic infections. And researchers have told that simultaneous COVID-19 and influenza infection doubles the death rate. This makes getting a flu vaccine in 2021 will be more important than ever. A flu vaccine offers the best defense against the influenza infection and its potentially serious consequences, and also reduce the spread of flu viruses to others. CDC recommends everyone older than 6 months of age to get flu vaccine each season by the end of October. However, as long as the flu virus is circulating, it is better to continue vaccination throughout the season, even in January or later. Flu vaccines are updated each season as needed to protect against the influenza viruses. This season's vaccine has been updated from the last seasons to better match the circulating viruses. There are two types of influenza vaccine. One, injectable influenza vaccine is given as injection and is approved for people above 6 months and older. Second, live inactivated influenza vaccine and is given as a nasal spray. It is approved for use in children older than 2 years and up to 49 years. Children younger than 6 months are too young to get the influenza vaccine, and people with life-threatening allergies should not take the flu vaccine. As influenza strains change each year, the vaccine is effective only for the current season, so it is important to get vaccinated every year. Flu is a serious and potentially deadly disease that spreads easily to others. Anyone can get flu, but the rate of infection are highest among children. Widespread vaccination may interrupt the transmission of flu viruses to others, since the outbreaks usually begin with the children and later spread to the community at large. It is better not to take flu vaccine during any kind of illnesses. However, if the child was COVID positive, you can take it after 4 weeks of being COVID negative. Flu vaccine will not prevent the COVID-19 infections. However, it reduces the burden of flu illnesses, hospitalization, deaths on the healthcare system, and conserve the scarce medical resources for the care of people with COVID-19. Serious side effects of flu vaccines are uncommon, but some children may have body ache, pain at the injection site, and fever.